What is sepsis? Sepsis is a continuum of systemic or widespread infection in the bloodstream that begins with bacterial invasion and can lead to multiple organ failure. In sepsis, a breach of the host barrier, often in the skin or mucous membranes, kicks off a dysregulated immune response in the host. Inflammatory mediators cause vasodilation and increased capillary permeability. These effects result in hypotension or low blood pressure. They activate the coagulation cascade and the complement cascade. The immune response involves the release of pro-inflammatory mediators that cause detrimental physiological effects, such as clotting in the blood vessels, causing blockage of blood flow and poor tissue perfusion, and tissue damage. Risk factors for sepsis include an existing wound, such as a pressure-associated injury, a traumatic wound, or a chronic non-healing wound, or infection, such as a kidney or lung infection. Other risk factors include a hospital or ICU admission, which puts a patient more at risk for hospital-acquired infection. Immune system deficiencies, such as HIV or cancer, recent surgeries, indwelling medical devices like central lines or urinary catheters, very young or very old age, chronic disease, or genetics. General clinical manifestations for sepsis. Sepsis will begin with general nonspecific symptoms such as malaise and fever. However, as the inflammatory response and tissue damage progresses, we will observe hypotension and tachycardia from the vasodilation and capillary permeability. Edema from the capillary permeability, tachypnea and hypoxemia due to tissue damage and poor tissue perfusion, and low urine output due to poor perfusion and kidney damage. Laboratory results will show an increased white blood cell count with a greater number of young immature white blood cells, also known as a left shift. Increased inflammatory markers such as C-reactive protein and erythrocyte sedimentation rate, markers of hyperperfusion such as increased serum lactate, and markers of organ damage such as increased glucose, increased creatinine, and increased bilirubin. Generally, we will see positive blood cultures as well. There will be signs of impaired coagulation, such as increased bleeding times, INR, PTT, and high or low platelet count depending on the timing. Sepsis occurs on a continuum, starting with infection and ending with multiple organ dysfunction syndrome, or MODS, and then potentially death. Initially, a localized infection occurs with localized inflammation. If not treated, this can cause a widespread inflammatory reaction called systemic inflammatory response syndrome, also known as SIRS. A SIRS diagnosis is made if two or more of the following occur: a temperature of greater than 38 or less than 36 degrees Celsius, a heart rate greater than 90 beats per minute, a respiratory rate over 20, a PaCO2 of less than 32, a white blood cell count over 12,000 or less than 4,000, or greater than 10% bands. Sepsis is diagnosed if there is a diagnosed source of infection and the patient meets SIRS criteria. SIRS may occur without an infection, as inflammation can occur for a number of reasons. Severe sepsis is accompanied by evidence of hypotension or hypoperfusion, indicating lactic acidosis, an SBP of less than 90 or SBP drops greater than or equal to 40 millimeters of mercury of normal. Hypotension results in a decrease of oxygen to the tissues, causing anaerobic metabolism and lactate production. In this stage, expect elevated lactate, low pH, low bicarbonate, and low blood pressure. In septic shock, hypotension remains despite adequate fluid resuscitation. For example, if a patient diagnosed with severe sepsis received a fluid bolus and had no improvement in their blood pressure, they would be considered to be in septic shock. Finally, multiple organ dysfunction syndrome. MODS is diagnosed when septic shock is accompanied by evidence of two or more organs failing. For example, we may see respiratory failure as impaired oxygenation and ventilation that requires mechanical ventilation, liver impairment that causes jaundice or elevated liver enzymes, kidney impairment, neurological impairment evidenced by decreased mental status, and cardiac impairment as cardiac arrest. If left untreated, MODS can result in death.